everyone, and welcome to day 4 of World Congress 2021 and the health tech track. We have an absolutely jam-packed day for you today, and I can't wait to introduce all of the various sessions that we have going on. So first of all, we have our opening keynote panel, Driving Digital Health Adoption Across Europe. Our moderator for today is Tobias, partner at McKinsey, and he's got some fantastic panelists. As always, please do put your Q&A questions in the chat function. I will do my very best to get them answered as quickly and swiftly as we can in amongst all of the fantastic discussion. So without further ado, Tobias, over to you.
Thank you, Becky, and really excited to being here today with all of you. And welcome to our audience to this panel, Driving Digital Health Adoption in Europe. I'm particularly excited about digital health adoption in Europe, as digital health could enable real benefits for European citizens, European patients, European countries, and Europe as a whole, but namely around better patient outcomes, but also keeping citizens healthy and well in the first place, and not waiting until they get sick to then cure them. But of course, there could also be a lot around how digital health can enable more precision medicine and personalized medicine, and bringing convenience to the healthcare industry, where healthcare traditionally can learn a thing or two from a few of the other industries. Well, however, also digital health is a complex topic where healthcare adoption is heavily influenced by health policy, by technical infrastructure, and the acceptance and the usage of digital health tools by citizens and by healthcare professionals. As part of today's panel discussion, we would like to explore 8 areas that can drive or cannot drive digital health adoption in Europe together with our panelists. So the first ones are around policy and regulation, namely digital health strategy of a country, regulatory environment, reimbursement conditions for digital health. Then we'll go a bit into 2 areas around the technical infrastructure, where of course electronic health records, data exchange, plus then e-prescription are some of the big enablers of digital health adoption. And then finally, we want to look into 3 other areas that can drive digital health adoption by stakeholders, such as the openness and ability of patients, payers, providers to use digital health, but then also the willingness and the incentivizations to actually do it for better outcomes and other benefits. And then finally, the connection within an innovation ecosystem, right? So I'm really happy that we have such a great panel today, namely Paivi Sillanaukee from Finland, Daniel Forslund from Sweden, Gottfried Ludewig from Germany, and Brian O'Connor from the European Connected Health Alliance. And without further ado, I just want to start with Finland and you, Paivi. And it's just amazing seeing what you've done in that space in the past year. Right, for our audience, Paivi is the ambassador for health and well-being of Finland in the Ministry of Foreign Affairs of Finland. But there is a lot more to Paivi and her experience, both in terms of public health, University of Helsinki, various clinical and managerial positions, and then also the policy work to promote public health, social protection, gender equality in Europe. So with that, Paivi, I would really be interested in hearing from you a bit like the role of the government that the Finnish government has played in driving digital health adoption, be it around the legislative framework, but also enabling and establishing digital services more broadly. So great having you, and looking forward to hearing from you, Paivi.
Thank you, Tobias, and hello and greetings from snowy Helsinki. Here is really much snow. Last year we didn't have it, so it's brighter here, and we are getting sunlight 30 minutes more during this week. So we are very excited and getting alive again here in Northern Europe. So from government side, we see that digital transformation and innovation are key drivers for sustainable economic recovery and well-being of the population. And government plays a key role in facilitating this change. Of course, the important base is that country, and we should have data, of course, and then we should have also infrastructure to use that data. And then I'll come to trust. I think that we are going to talk about that also later on. But we have been in Finland, because we have been taxation-based welfare system and society. We have been gathering data from our people for decades. And the basis has been in legislation, so that we have been able to keep the trust in our society of collecting that data, which is then related to the identification number of each other, of our people, and also then been able to use that, so that people have really seen the importance and also the benefits of the data and digital services. There have been incentives for our society and for our public sector then to try to have effective services, and we have also had a very high know-how on technological issues, so therefore also we have been able to develop then solutions. So there has been a very good basis for us then to use and even use the data also further. Coming to the health and social services issues. So the government has several means to enhance the ecosystem, ensuring legislation and guarantee secure access to the authorities, institutions and companies, so that they can utilize social and health data and research, development and innovation activities. And Finland has laid down a separate law on secondary use of the health and social data, facilitating the ecosystem development with funding and management mechanisms. And we have also invested in personalized medicine research, innovation, education and data management centers of excellencies like National Cancer Center, Genome Center, Pharmaceutical Development Center and Neuro Center. So we have been really enhancing, trying to then build an infrastructure and processes for this usage of the data, also the sensitive data. And we are trying to find out also financial ways then to enhance and facilitate the ecosystems where private sector and academic, but also public sector can work together.
Perfect. Thank you. We'll definitely come back on the data topic and the secondary use of data and the ecosystem topic later, Paivi. But moving now quickly from Scandinavia and Finland to Germany. Gottfried, pleasure having you here, and hope that the weather is okay in Berlin. I escaped to the south of Germany. For our audience, I think many of you know Gottfried. Gottfried is part of the German Ministry of Health, and he's the Director General for Digitization and Innovation. And as part of that, together with Jens Spahn, one of the key drivers of digital health adoption in Germany, and of course with the EU presidency, also within Europe. Gottfried, being German myself and knowing some of the complexity of Germany's being a complex federal country with 16 different states, and the complexity of such a health system that is to a large degree governed by self-administration. It would be great to hear a little bit from you the story. Maybe starting with the past, sort of what has been the journey getting this done in a pragmatic way, considering German perfectionism, but then also maybe a little bit of an outlook where you think this could be going.
Oh, so first of all, Tobias, thank you very much for having me. All the best to everyone from rainy Berlin, gray skies. So I think we all look forward, not only in pandemic times, we all probably look forward to spring and summer to arrive very soon. So, however, good to see or to meet you all and to discuss this topic this morning. Well, actually, well, those two topics, the question of our complexity regarding the federal structure is for sure kind of challenging, but I think it's also an advantage, you know, like often in lifetime, it's two sides of a medal, because on the one side, the advantage of a federal system is you have a lot of people, a lot of, you know, associations, a lot of people who really get things done and who really like to take responsibilities, who see the challenges in their day-to-day life in the healthcare system and to try to find a solution to their problems. The challenge for us then on a national level is to have all of these different solutions working together and to have an interoperable way of connecting those solutions. And one thing, so for me now doing this for 2.5, close to 3 years with Minister Jens Spahn, I think the first thing is really about, so it's about leadership. Transformation also in a complex environment in Germany is possible if you take responsibility and if you give guidelines and if you move forward and if you tell everyone, you know, yes, also if your solution, your perfect solution in southern Germany has to adapt to a new world, has to have open interfaces, have to stick to the rules of standardization, and I think this was the path we were moving forward to tell each and everyone, yes, it's good that you take responsibility. We want to foster also your role in the system, but there are certain guidelines. There is a regulatory framework which you have to stick to, so that we will come to a system which is really connected in an interoperable and standardized way. And I think, I mean, Paivi already mentioned a lot of the role of data in the future and how Finland is paving the way already, probably for all of us in Europe, and it's a very good leading example. And this is one of the messages which was probably kind of challenging, but I think which is now better and better working from the perspective of a federal complex system. But I think the most dangerous illness regarding digitalization in Germany is what you already mentioned, is the perfectionism. It's that we never, we are used to, a state regulated system only can be presented and introduced to the system if it's already working in the most perfect way you can ever think of. But this is maybe working in the pre-digital world, but it's not working in the digitalized world. And so it's a challenge to our mindset to tell the people, yes, we present the best thing possible today, but it's not the perfect way, right? We have to work on that every day. Agile kind of working is not only something, for industry or for startups, it's also necessary in the public administration and for the regulator in the healthcare system. And this is something we are still fighting, not only a pandemic, but also the perfectionism in the German mindset regarding how to steer a healthcare system. And last thing, just to mention it, however, I think especially the Corona pandemic in the last 10 and 11 months showed us how wonderful this could work, right? I mean, looking for our registry for ICU capacities, we just started from zero within 4 weeks to a system where still the people had to type something in, how many beds are available around the 2,000 hospitals in Germany. And in another 4 to 6 weeks, we had that integrated in the IT systems of the hospitals. And this is the way of working, I think, which could lead a good example for the upcoming years. So never waste a good crisis. And I hope that we keep that mindset also back in the new normality.
Thank you, Gottfried, and I will not let you out on the outlook, especially since you have a book behind you that has 2030 written on its chapter. But before we come back to that, Daniel would love to hear a bit from you and from Stockholm and Sweden. For our audience, Daniel is the chairman of the Innovation and Development Committee in the region of Stockholm and has broad and long and great experience related to digitization, innovation, medical technologies, e-health, standardization, etc. It would be super to hear a bit from you, Daniel, around that culture of innovation in the Stockholm area and how that drives the adoption of digital health. And if you maybe at the end also could address the first question that I see here from the audience around, what do you think in Sweden is the biggest incentive for the drive of digital health adoption? But yeah, looking forward to hearing from you and the learnings from the Stockholm area.
Thank you, Tobias, and I'm very pleased to be here. Well, yes, Stockholm has been working very systematically in creating an atmosphere and a culture of innovation amongst especially health professionals. And when we now evaluate the crisis during last year and how we can move forward during the continued crisis during the pandemic, we can see that creating possibilities to innovate has helped the healthcare sector to really renew itself during this pandemic and find entirely new ways of interacting with patients without them having to travel, interacting within healthcare, so that health professionals don't need to travel, or and also can save a lot of time for everyone involved. And we have been working systematically to create those incentives. We created an internal innovation fund in the region of Stockholm, so that all our 45,000 employees in healthcare could apply for innovation projects and funding internally, so we don't have to go outside always to find that kind of seed money, so to say, internally. But we also formed innovation offices at our hospitals, inspired by other health organizations across the globe. We've seen many of those both in the UK, in America, and Israel, for example. And that means that a nurse or a doctor could then go to the innovation office locally at their hospital and really have practical help on how to go about to get their idea tested and brought to it from an idea to a project and then implemented. And that has been very successful. We have been able to fund and implement actually over 300 projects during the last 4 years, and also have been now issued a policy from the regional government that now all managers in healthcare should help foster this culture of innovation by helping and encouraging doctors, nurses, and other staff to actually work in improving their daily life. And we can see during the pandemic that since we put a lot of efforts both in the policy decisions and also minimized a lot of bureaucracy and detailed governance during the pandemic, we could see that culture of innovation flourished during the pandemic. We could very fastly adopt new health technologies. We had launched a health app for primary care since almost 3 years back. And that could be expanded to both specialized care, to all our 5 emergency hospitals and our university hospital, so that we could really target the risk groups through online meetings. So they didn't have to travel when they needed to visit their doctor, for example, cancer rehab, for heart diseases, for obesitas, and other treatments that needed to go on during the pandemic. So we could increase the number of online doctors' meetings by over 1,300% in only a couple of months. And we could also launched this technology in only 3 weeks during March last year. So I would say without that long and sometimes tiresome work to really foster this new culture internally, we wouldn't have been so good at really adopting and using that new technologies. Now to your question, Tobias, about adopting new technologies. I think that it needs to be a mix of creating the possibilities and incentives, but also be very clear from a governance perspective that now we require them to also offer digital means. And in Stockholm, we have made a decision 2 years ago to guarantee the patient the option of choosing how you want to contact healthcare. It could be through ordinary telephone, it could be through a text-based chat, sending a picture perhaps on your wound or your rash. It could also be a video online meeting, or it could be just a physical meeting if you need an exam, for example. And in each case, you should be offered that possibility to really interact with healthcare according to your needs as an individual. And I think by requiring that from healthcare providers and also creating incentives that you are paid when you have online meetings, then we have been able to increase the pace of implementation of digital tools. Yes.
Thank you very much, Daniel. You already alluded to that this kind of innovation and adoption work can sometimes be cumbersome and hard work, and I think that is where I am curious to hear from you, Brian, and you know, for our audience, Brian is the chairman of the European Connected Health Alliance, and he has done this work for a long time and is really one of the pioneers around digital health and e-health adoption, initially in Europe, but also increasingly in the world. So Brian, would love to hear from you a bit around what's your learning there around the role of collaboration and networks that and what these play in the role in the adoption of digital health, and ideally also a bit your underlying motivation, because why are you doing this very hard work for such a long time?
Probably because I don't have much of an imagination, I suspect. No, I started, this is 10 years old now. I just realized this year is our 10th anniversary for the European Connected Health Alliance. When I started it, it was, one of my friends said, "You're delusional." And I said, "Well, that's normal for me." And then they said it was delusional because I was the only person in the European Connected Health Alliance. If you think of each of the words and the terminology used then, I was delusional, but I was also ambitious. And what drove me to do it was a sense of frustration. And some of it has been highlighted in a more positive fashion by the previous panelists. And that is this: everywhere I went, I found really good people with brilliant ideas, complaining always about the obstacles that prevented them from being even better people. And above all, I found that there was a real desire to help citizens, not just patients, but citizens as well. And you think, well, why don't you just do it? Well, the government policy doesn't allow you to do that. Or, you know, government hasn't a clue of what's going on. They're just dictating to you, giving you regulations, but giving you no incentives or assistance or pathways to make things happen. Now, that was 10 years ago. Some of that still exists. But when you just listen to this panel alone, you realize that, first of all, these governments, and I have a lot of experience of working in Finland. We've been there for 8 years, working in Oulu, Tampere, Kuopio, Helsinki, etc. And more recently worked a lot in Germany with your colleagues, Gottfried, Nick and Niklas, and so on and so forth. And also working in the Nordic countries there, Daniel, as we know each other. What I found is there's been a realization, accelerated by COVID, but a realization that the governments have to decide, what is your role? Is it simply to dictate? Is it to facilitate? And when you hear Daniel talking about having created incentives and funds and above all, openness, then you realize why. I mean, that confirmed in my head that I was maybe delusional then, but not so much anymore. And what I decided was the human factor is really important in this. It's about how the person on the ground feels. And also, I wanted to kill off some of the silos. I have failed to do that because some of them still exist, because some of the silos are quite big and the people inside them think they are the world. But what I realize, if you bring governments, national and regional and city governments together with research institutes, we have 220 or something research institutes in the European arm of our alliance, but also bring together then industry from startup right through to global. Then you bring in patient groups. I smiled, 5-6 years ago, someone had this brilliant idea of put patients at the center. And I thought, that sounds right. We all went, yes, good idea. And then I started to see PowerPoint slides appear. And the only thing they did was in the center of the slide was patients. And when you pressed the center of the slide, there was nothing there. In other words, there was lip service given to involving patients and citizens. We took the view that's a waste of time. And therefore, we went out and recruited over nearly 900 patient groups now who are members of our organization. And not only we just bring them in, we actually bring them in to collaborate with creative clusters. We get the entrepreneurs and innovators to listen to the patient, because I often worry that patients are not listened to. And they say, no, that's a wonderful idea, but I would never buy that. So why don't you go and invent something which actually fulfills my need? So it's that interaction. Plus we bring in venture capital, private equity, economic development agencies, it's health insurance companies, et cetera, et cetera. It is the bringing those people together. And the last thing I'd say is this: you can't make that happen unless you've got a structure. It has to be dynamic enough to change. As Gottfried was saying earlier, you can't just say, that's it, we're not changing it, because everything changes. What we decided to do was create our ecosystems. And these are permanent, multi-stakeholder communities in a defined geographic area. What they do is they meet 3 or 4 times a year in their own region or city. We then, as the Alliance, connect all 55 of these now in Europe, 55 communities. So we have intelligence, boots on the ground, listen very carefully, and then coordinate those people, those organizations, so that they feel, A, they're part of a much bigger world, B, they can access best practice, they can access ideas, and above all, they can feel part of a community who are all driven by the same thing. They may have different motivations internally. Clearly, businesses want to make money. Governments want to ensure that the money they're putting out there is spent wisely, etc. But when I look at the advancements that have happened in the last number of years, I'm really actually quite encouraged. There were times when I was quite depressed. We're never going to make this happen. And I was encouraged to have made, if you don't mind me saying so, particularly in Finland, where the trust you talk about in government became obvious to me when I started to work in Oulu, of all places. And then I realized, of course, that you can actually get your citizens to understand that they should collaborate with you because it is in their interest to do so. Because you've got the very straightforward Finnish way of explaining, why you should join us, please. That's why you've got Kanta. That's why you've got Sitra up there. That's why you've got your secondary use of data, working closely with Estonia across the way. So I think I feel really encouraged at the moment. When I listen to this panel, I think this is really fantastic. But I just want to say this: we cannot be complacent. We've learned a heck of a lot. We do not want to go back to the old normal. We want to keep this determination, just to have passion and determination to continue to connect. And that seems to me to be the road for the future.
Thank you, Brian. I'll now open it up much more towards sort of conversation among the group here. But since it was mentioned a couple of times in the intro statements, right, there is adoption of digital health happening on a regional level, right? Like, let's say, Stockholm area or the ecosystems that you alluded to, Brian. Then there is adoption of digital health happening on a national level, driven, of course, by you and Jens Spahn, Gottfried. And then there could be adoption on a European level, right? And maybe just sort of looping back to the German EU presidency, Gottfried, and would love to hear your thoughts a little bit around that, also around digital health adoption around a European level. And then I invite every one of the panelists to join in and share their perspectives, right? And the last thing I'll say is, right, I've seen a lot of sort of the let's say the HTA assessments, reimbursement, etc. for pharma medical products, right? And they are very much country specific, and it has been a decades-long discussion to harmonize that after every country put their stake in the ground, right? Is there an opportunity here now to do actually something at the European level let's say, right away in a proactive way, instead of waiting for every region and every country defining their thing and then trying to harmonize it afterwards. But Gottfried, would love to hear a little bit your thoughts, especially given the German EU presidency, and then please everyone react.
Well, so thank you very much. I mean, there is for sure a European level. I think everything we are doing on our national level is always also, I mean, we were not the front runners, as everyone is aware of in this group before. So we everything we are now doing actually is always done with a perspective also to Europe. I think, as I mentioned before, the question of data in the sense of the access to data, but also to high quality of data in the sense of standardization, for me is, and to have a real reliable regulatory framework. What are you allowed to do with the data and what are you not allowed to do with the data? I think those are three major pillars I always try to foster, we as presidency try to foster in the last month, because I see a very important role for Europe. And if we want to be competitive regarding or looking to Israel, looking to the US, looking to China, we have to redefine our look to the use of data, especially in the context of healthcare. Because if we are not doing it, and I mean, this is probably a very national perspective of Germany, but I see also maybe in other member states this kind of discussion. If we are not doing this, if we don't redefine our perspective on the use of data in the healthcare system, other areas in the world will do it. Yeah. And then they will lead the question, they will steer the new way of how healthcare will be provided. And there will be no chance for Europe. And we always try to foster this. And I see a very, very important role. And to be more positive, I see really a very good chance in that for Europe to move forward with that. Also, especially with our data privacy perspective. But the data privacy perspective should never lead to the conclusion we don't use data. You know, this is maybe the mistake we too often do in Germany, and this is something. But you ask for the European perspective. This is something where we really want to work with all our European friends to push that forward in a very fast way.
If I can just breach in here, because I think this is a really important point to see that we don't compete between countries in the European Union. We need to compete towards the world because so much is happening now, and we need also to help our both care providers and also technical companies. So everything from entrepreneurs to the big pharma and big tech companies. To set the standards, to set the common ethical rules, for example, on how to handle health data. And we know if we are to develop the new artificial intelligence-based decision support systems, for example, in healthcare, or providing patients with that kind of insights that we need for personalized medicine, for example, we do need to offer them high quality and structured data from healthcare providers, and that requires also then a legal framework making it possible to use cloud-based storage, for example, and analytic tools. That is actually, I think, a European or perhaps global concern to really make this both technically, politically, and legally wise in a way that we haven't reached yet. And I think there the European Union can do even more to make clarifications and set the common framework to this kind of development. So we won't lose pace compared to the US, to China and other evolving countries now really pouring in money into this area. And I think we can also have another angle of this, just making this ethically sound when we're speaking about AI, for example.
I would also like to comment here, and I also think that Europe has a responsibility also to play a leading role here. As I mentioned, but also the others also have mentioned about the trust and the importance of trust, of being able to use the data and having the data also available. And if I think about AI solutions which really would help people in their everyday life, what kind of information and data is needed? Biological information, but also behavioral information and data. And those are the informations and data that people are most worried about. So there is need for ethical basis of a regulatory basis of using the data, and in that way building the trust of population and people on using the data. And that's why it's important that we have an open conversation going on European level. And I mentioned here European level, not only EU level, because we need UK to be part of this dialogue also. And there is no mean, I think, to use the data only and solutions inside one country. So the flowing of the data cross-border is really important issue. And therefore, we have to be patient, but we have to have the dialogue going on. What Brian also said, that having this kind of platforms where different partners can really have a conversation, know what the other one is doing, and then also trying to find out the way where the incentives are from everyone's point of view, then reasonable. And we have learned also in Finland that we wouldn't have been able to then have the legislation for secondary use of the data if we haven't had an open dialogue with also companies there on what kind of regulation is good for them also, and what kind of pricing we should have for the data, but also to introduce and tell them what is then the point of view of people, and also from our government. So that's why it's so important that we have this kind of dialogue going on. Now we have seen at the EU level, there is a Data Governance Act we have in public discussion now, and Finland is the leading and chairing the joint action of European health data space. And there we have a possibility that during the coming year and years, we can define at the EU level then what are the regulations and what are then the rules of using the data. And we need people, patients, but also other people broadly to participate into that discussion, so that we can build the trust and then be able to really develop the world for the world, the solutions which have an ethical basis.
So just to add we used to say tuppence worth, it shows you how old I am talking about tuppence. Pick up on the 2 or 3 quick points. Within the ECH Alliance, we realized, of course, way back, that we needed to have a health data arm. Now, we're all non-profit, but we created the Digital Health Society. And we actually created this with the Estonian government when they had the presidency in 2017. And what we realized then, and they realized then, was that presidencies, even this rotating presidency, have a power provided they have a legacy approach. So the Estonian government were not interested in just doing the 6 months and then everything dies, but rather we help them create the Digital Health Society, which focuses on exactly what the other speaker said, is to try to actually understand what we should be doing. And we often hear for years now at data conversations all about the security. How are we going to protect people? That's like saying we should ban, or we should not have any airplanes in the sky because they're dangerous. You could crash. So we say, oh, the heck with that. I like to travel. We all would love to travel now. What we did, think about that, and think about the car as well. We could ban all cars. You wouldn't have any car accidents. You certainly would hit the economy and you'd cause all sorts of other problems. What we do with any issue, any problem, is we see it as an opportunity. The Chinese have got this saying, as we know, called Wei Jie, which is one word standing for crisis and opportunity. We've seen a real element of that during the pandemic. And the thing is that we should take data security, all of that privacy thing, and see it as an opportunity by putting sensible regulation, the ethics, the law, etc. around it, but don't let that slow you down. You have to move at a pace. Second point I'd make is about competition globally. We are fortunate in that with our similar organizations in India, in China, in the US, in Latin America even, and Africa more recently. Europe is way behind in many, many things. There is an attitude. I remember once someone in the commission said to me, oh, well, we can't do that because we wouldn't use Google and Amazon and all these other names because we want to use European. And I said, okay, name the equivalent in Europe of Google, Amazon, Apple, etc. If we've got them, I'd rather use them. Reality, we're already behind the curve. And so we need to actually approach it in a different way. And I'm all for taking on and competing with all of those other continents. But I think you need a coherent, determined approach. I think, last thing I'll say is this, I'm actually quite encouraged by the commission actions in the last number of years. I thought too often they were there as almost like, you will do this, you won't do that. Now they're much more open. And I thought one of the genius things, whether it was intended or not, that came out was, one of you referred to it, the European health data space. I remember saying to someone, what does that mean? And the answer I got was, we don't know yet. And I think it's exactly the right thing for a commission to float, because what is Gottfried and his colleagues, what have you done in Finland leading it? You've all filled the space. You've got recommendations coming out. You've told them there's a space, fill it. And I think that's a very clever, if I may say, innovative approach by the commission, not to think they have got all the answers, because nobody has all the answers, but to encourage all of us to contribute elements of the answers and then get a coherent, cohesive approach to it. So I think we just have to not allow a few people to derail us or slow us down. And that's happened a lot in the last number of years. And I think hopefully we're past that stage because of the pandemic experience. Tobias.
Thank you. Maybe just since we are nearing the end of the session, I wanna connect two things that were mentioned, right? Daniel and Brian, you talked a lot about innovation ecosystems and also industry, and Paivi and Gottfried, you talked about health data spaces. Right, I'm now a bit provocative and painted a bit black and white, right? But I think for Europe, we now have sort of two big choices, right? Option one is that we create some health data space that makes universities and academics very happy because they can write great research papers about it. Or we can also set it up in a way for Europe to actually drive and foster the European innovation ecosystem, where then companies, startups, established healthcare companies, whoever actually within, of course, a secure and safe and meaningful frame can actually drive innovation for the benefit of Europe as a whole. And that also then includes employment and other benefits, right? And as you've probably can feel already, I've been at a university where you go, where a great career was writing 400 research papers and not founding a single startup, right? And I actually prefer the option two, right, where we maybe write a lot of research papers, but we then also create companies and employment and actual, you know, Brian, as you said, the Googles or the Amazons. I just wanting to hear from you sort of how you're thinking about European health data space, not ideally achieving both or one of the two, and etc.
I would like to say here that we really need to go further quickly, and we have seen here during the COVID-19 that we can really enhance the speed we go, and people see then really the benefits here, and we have to build on that. And for companies, I can say that here in our countries, which are represented here in this panel, there are possibilities really to do now, to do hands-on things, develop solutions. For example, in our biggest university hospital, HUS, there is a Clever Health network where you can participate, and then you have all the information there, the data there, which is then related to the identification number for the primary use, but also for the secondary use, when you then do the regulatory things. But what we have learned there is that that during that process, it's very important that from the beginning, you and in early phase already, you begin to think about the regulatory aspects, but also the deployment and the implementation. And in that kind of networks, like in Clever Health, there are many other companies also, and quite often it is so that when you are solving a challenge, you need other partners too. So therefore, the ecosystems are very important.
I see we are at the end of our slot already, and we haven't even talked about reimbursement pathways. Maybe one or two final comments from people before we wrap up for today.
There's so much to say, Tobias, actually, but I just want to say I support your idea to get everyone involved. Especially, there's always the perspective. There's the good side of research, and there's the bad side of research. Industry bad, university good, and I think we have to get rid of this very simplistic thought. That's not true. Right. It's about having a good idea of a better drug, of a whatever, better treatment. And if it's done by industry or by university, I don't care. If we really put the patient in the center, I only care if there is a better way of treating me. First thought. Indeed. Second thought, we really have to talk also about money. We have to do that in the next round maybe. But we, for example, just allowed our statutory health insurance companies to invest in venture capital for healthcare. Because if we have only, startups and with wonderful ideas, also, coming out of university and have an idea for a product, and then we have only people who finance it from the US or China, we do have a problem as well. So that's just two basic thoughts, maybe for our next round of discussion.
And just very quickly, I would just sum up by saying that our ecosystems, our 55, are exactly what I think everybody should do, which is you literally have to bring everyone into the room. Even the silos you bring into the room, at least they're in a room with someone else. And then you have to have all the parties at the beginning to listen. First of all, you listen to them, and then you set out a structure and a process whereby all of this can be achieved. I'm fed up actually with researchers who think the only thing in the world is research. I'm fed up with companies who think that the only thing they've got to do is raise money. The reality is, I mentor a lot of companies. I have 36 of my own startups. And I'm saying, would you, for God's sake, address a need? Too many inventions and innovations are because it's nice to do. Whereas in fact, you should say, what is the need? Here's the solution. And then don't go to China or India or US for funding. It should come from Europe. We're big enough to do that. It's connecting the dots. And we don't do that as efficiently as we ought to. No, I'm going to carry on doing what I'm doing, hopefully.
Thank you for your final statement. I think it's a it's a great final statement also for our panel. And then when we do our next panel at some point, let's have a 5-hour slot instead of 5-minute slot. Thank you very much.
Thank you
all of the panelists, all of the audience, and over to you, Becky.
Thank you so much, Tobias. And 45 minutes is never enough for anyone. But as you say, next time hopefully we can chat for a bit longer, or obviously further the discussions. But as always, the panels are here for people in order to reach out to one another. So I hope that everyone on the panel today will get some great connections in terms of the discussions that have already been had. So thank you once again to Tobias and to all of the panelists. I will be back here in just over 10 minutes, where we have the US payer perspective on telemedicine. But until then, have a quick break, grab a cup of tea or coffee, and I'll see you back here shortly.